When her mum got sick, Denise gave up her job to look after her. But that also meant giving up her livelihood. And with no financial support from the government, her savings were quickly drained.
We rely absolutely wholly and solely on mum's state pension and her disability benefits. We're not building up any savings. You're not paying anything into a pension fund. You are thinking, well, what happens? And also, what happens when mum does pass?
There's another one.
Concerns shared by millions of other unpaid carers who, like Denise, can't fit work with caring, though their Labour campaigners say props up social care.
The system would absolutely collapse without unpaid family carers. 7 million across the UK, and they are providing all manner of support. Otherwise, people would be in hospital, they would need far more help from local government, from social care sources.
Despite that, about half of unpaid carers don't get any state support, and those that qualify get just under £70 a week, compensation that peers say doesn't match their contribution. Unpaid carers are filling the void in government social care, according to a new report by the House of Lords, and that is putting financial, physical and emotional pressure on those carers who the report says are at a breaking point. But the government says they are giving support, telling us in a statement, since 2010 we have increased carers' allowance, putting an additional £800 a year in carers' pockets, while the amount someone can earn while remaining eligible for the support has increased by around a third in that period. The cost of caring, though, is not just financial.
I always feel very guilty that she's had to give up so much for me. She's not got any social life. She hasn't had the prospects of her career as she could have had. She has had to give up an awful lot for me.
A feeling of guilt that many of those cared for share. Milena Veselinovic, Sky News.